Germany is struggling to cope with a surge of COVID-19 infections. Despite being in a soft lockdown for 5 months, the number of cases is going up, and hospitals say they're being pushed to the limit. Today, the cabinet here in Berlin agreed to approve new national measures to try to bring down infection rates. These new measures require a change in the law to allow what is being called an emergency brake to be imposed in all parts of the country if certain conditions are met. Now, this new law would oblige all regions to implement this emergency brake if there are more than 100 COVID cases per 100,000 people in a 7-day period. Then a curfew would be imposed between the hours of 9 p.m. and 5 a.m. And then all non-essential shops would also be closed. Chancellor Angela Merkel welcomed what she called the urgently needed decision by the government.
In order to improve the situation and to slow down the third wave, to break it and turn it around, the measures implemented thus far by the state and regions don't go far enough. Our response to the pandemic must be more stringent and consequential.
Let's bring in our chief political editor, Michaela Kufner, who is standing outside of the Chancellery for us. Michaela, you were listening in to the Chancellor's message. Tell us more about what she had to say.
Well, she basically called this step of now implementing a national drive, a national emergency brake, as a long overdue, as setting the corona fight on a new footing. And what that means is that Angela Merkel took Germany's corona response next level. Instead of continuing to gather the 16 state premiers around her, getting an agreed paper, and then everybody going into their federal state and doing whatever they like, pretty much, she's now making this legally binding. Well, she doesn't mean that she can do it alone. She still needs that signature on the dotted line by enough MPs. She's taking this to Parliament, and she's getting the states to agree to it. And that would then make it legally binding, and there would be an immediate emergency brake implemented at that magic figure of 100 infections per 100,000 people within the space of 7 days. And that already applies to pretty much most of the country.
Why is this question of taking a national approach so controversial?
Because there was a lot of credibility lost when state premiers didn't stick to what they said and kept carving out exceptions for their own states. That has created a lot of confusion. That has cost everybody a lot of public trust who works in public policy. And that is also to blame for Angela Merkel's own party dipping in the opinion polls and these latest infection rates going up once again. We are in the midst of that third wave here in Germany. And a majority of Germans is actually for a tougher lockdown. And if you ask people on the street, they certainly want to know which rules apply wherever they go, and not on a 100-kilometer drive have 3 different sets of regulations apply.
You said that the Chancellor will have to take this new law to Parliament. What kind of support will she have for it there?
Well, it looks like she is getting enough support to take it to Parliament. The big question now is, will it be fast track? Can this all be decided this week? The parliamentary groups are currently meeting as we speak here. So still more intense debates to be had. But this looks like it's definitely going ahead in Germany, with experts warning, hospitals warning that it's simply coming too late. Angela Merkel herself said, I said a long time ago, she said, if we wait until those intensive care beds are filling up and are full, then it's too late. And Germany is pretty much nearing that point right now.
Our chief political editor, Michaela Kufner, with the latest. Thank you. Now, aerosol researchers are criticizing coronavirus measures, and they are calling for a radical rethink. They say infections outside hardly take place. And we can speak now to Christoph Aspak. He's the president of the Society for Aerosol Research. He's taken part in this research. Thank you very much for joining us. Now, tell us what the research shows about how COVID is being transmitted. What are the findings here?
First of all, we have known for several months already that it's mostly an aerosol transmission, so airborne transmission of the virus. And at the same time, we know that aerosols or aerosol particles, as we exhale them, they're quickly diluted when you're outdoors because there are always wind currents, there's always a thermal motion upwards, and that quickly dilutes the virus concentration, and therefore it's very unlikely that you get infected outdoors, whereas indoors it's much more likely because the virus concentration can accumulate. And there has been a recent study published in Ireland, and they checked more than 230,000 infections, and they found that 99.9% of them actually occurred indoors. And that's what we try to make sure that everyone understands, and also in the general public, that it's the highest infection risk is actually indoors and not outdoors.
So you're saying basically the measures that are currently in place, they don't prevent infection, they might even be counterproductive. So which measures would that be that don't help really?
Well, what we criticize is that there's too large focus on measures for outdoors, whereas outdoors, nothing really or almost no infections occur. These include the duty to wear a mask when you're outdoors, that several places which are very popular are locked. Like along the Rhine River, for example, here in my area. And that doesn't really help because we should focus a lot more on the indoor infections. And that applies to, well, all indoor environments. That includes private homes, that includes workplaces, that includes shops, that includes public transport, and so on. And that's what we try to bring along, that it's really the indoor environment where it can get critical.
Okay, so what measures would you recommend to the government to take right now, if you could advise them?
Well, I mean, several measures are already taken when it comes to public transport, and it's really critical that these are checked and make sure that people really follow these rules. And it's not only the government, but it's also the media and just the general public that needs to understand that you need to be careful indoors. And there are several very simple measures, and I don't really think that you need a law or anything to enforce that, because what people should do is open windows and exchange the air that is indoors whenever possible. So when the weather is fine, just leave the window open all day, basically. Wear masks whenever you meet people. Use air cleaning devices to reduce the virus concentration. And most importantly, limit the number of contacts indoors. Outdoors, it doesn't really count, but indoors, limit the number of contacts and limit the time that you meet these people indoors. And these are the most important things to keep in mind, and that can help to reduce the infections.
I'm wondering, you said, a lot of this research has been around for some time now. We know that infections are spreading more indoors, far more indoors than really outdoors. Why do you think that hasn't enough really been informing the policy that's been taken?
Well, that's a very difficult question, and I think it goes beyond what I can judge as an aerosol scientist, because I think it has a lot of political reasons, and it's probably easier to control outdoors if people are not gathering and if people are really wearing masks, because then they're out in the public and you can see them, whereas indoors you can't really enforce these laws. So it's a lot. But on the other hand, I understand that it's not so easy to control that people are following these measures, but it's important to make sure that everyone understands that really indoors, that's where it can get dangerous.
Thank you so much for your insights, Christoph Aspak, President of the Society for Aerosol Research. It was good to have you with us. Let's take a look at some other developments in the pandemic now. In the U.S., health authorities are recommending an immediate pause in administering the Johnson & Johnson COVID-19 vaccine after 6 people developed rare blood clots within weeks of getting the shot. It comes a day after 55 million doses of the jab started to be delivered to the EU. India will fast-track emergency approvals for COVID-19 vaccines that have been authorized by Western countries and Japan. The country is ramping up its vaccine rollout efforts as it battles soaring infection rates. And the Director General of the World Health Organization says confusion and complacency means the pandemic is a long way from over. But proven public health measures could bring it under control within months.